Hi there.
Hello. Would you like to schedule your next dental appointment?
Yes, please.
So, how did it go for you today?
Oh dear, the dentist had to fill a couple of cavities.
What type of fillings did you get?
The silver kind.
You mean the one with mercury?
What? No way, that would be crazy. Who would put a dangerous neurotoxin such as mercury in a tooth filling, inches away from the brain? I got the silver kind.
Unfortunately, silver dental fillings are actually made from 50% elemental mercury, plus various amounts of copper, tin and zinc.
Are you kidding me?
No.
Unbelievable. Why didn't my dentist tell me the silver filling contained mercury before he put them in?
Most dentists don't think it is important for patients to know because dentists believe the mercury is locked in the filling once mixed and placed in the tooth.
That makes me feel better. I knew there must have been a good reason.
Unfortunately, it is not true.
Hold it, what do you mean?
It has been scientifically proven that silver amalgam fillings continuously release mercury vapor and mercury-contaminated particulate matter.
Then it must be the safe kind of mercury, right?
Dentists are under the impression that mercury magically loses its toxicity when it's mixed with the other alloys and placed in the mouth.
Oh good, I was worried there for a second.
But there is no safe kind of mercury, much less the kind that is released from mercury dental fillings.
Are you sure about that?
Yes, as a matter of fact, in the lawsuit Barnes vs. Kia, the amalgam manufacturer claimed their warnings also pertained to mixed amalgam.
Seriously? Then the mercury must be released at extremely low doses, right?
It is not the dose itself that determines safety, it is how that dose compares to levels considered safe or without anticipated harm that determines whether or not the dose is significant with respect to health concern.
Okay, so silver amalgam fillings contain 50% mercury and constantly release mercury vapor and particulate matter?
That is correct.
Is the amount released just a small amount?
Irrespective of quantity, a small dose can present a risk if the substance is toxic and received in doses that exceed a reference level considered safe. And mercury is considered to be one of the most toxic non-radioactive elements.
Oh my, what else should I know?
Scientific studies published in peer-reviewed journals have repeatedly shown that the largest contributor of mercury in the general population is that from silver dental amalgam fillings.
I thought it was fish.
That is incorrect. In addition, your body absorbs mercury from amalgam fillings at levels higher than government-established safety doses.
Bloody hell, that doesn't sound good. Why doesn't my dentist know this information?
Your dentist was taught it was safe in dental school, so it is hard for him to accept the reality that amalgam fillings represent a potential hazard to health. Plus his trusted sources of information, such as the FDA and the American Dental Association, says it is safe.
Sheesh, who determined that students should be taught dental mercury is safe?
The American Dental Education Association sets study criteria and accreditation for dental schools across the nation.
Regardless of what they are taught, dentists need to know this information so they can tell their patients.
But they won't be able to do that.
What? Why not?
If your dentist did warn you, or advertise that he thinks mercury fillings are a health hazard, the local or state dental boards would try to take his dental license away.
Hold it. How can they do that?
Local and state dental boards are primarily made up of American Dental Association members, and the boards adopt the ADA Code of Ethics.
So what does that mean?
The ADA Code of Ethics states that the dentist has a duty to respect the patient's rights to self-determination, and the dentist should inform the patient of the proposed treatment and any reasonable alternatives, in a manner that allows the patient to become involved in treatment decisions.
My dentist didn't give me any alternatives to the mercury filling.
The Code of Ethics goes on to state that all dentists have the obligation of keeping their knowledge and skill current, and they have a duty to communicate truthfully. Additionally, dental professionals have a duty to protect the patient from harm.
That sounds good, But based on the code of ethics, you'd think dentists would be talking non-stop about the potential harm from dental mercury.
Yes, one would think.
So if dentists followed the ADA code of ethics, that would mean the dentist's primary obligations would include involving patients in treatment decisions in a meaningful way by informing them of the risks of mercury fillings.
Yes, that is correct.
But that is the exact opposite of what my dentist did. Had I known there was mercury in the filling, there would be no way in hell I would have let him put it in my mouth.
See how the problem perpetuates itself?
Yes. But if dentists don't inform patients amalgam fillings contain mercury, the most toxic non-radioactive element, which has been linked to a number of neurological issues and other health problems, then how are dentists living up to the ADA code of ethics?
Exactly my point. They are not.
Now I'm worried about this mercury affecting my health. I want to go find a dentist who will remove my mercury filling.
You can't.
Why not?
It's unethical.
Are you serious? Says who?
The American Dental Association says based on available scientific data, the ADA has determined that the removal of amalgam restorations from the non-allergic patient for the alleged purpose of removing toxic substances from the body, when such treatment is performed solely at the recommendation or suggestion of the dentist, is improper and unethical.
So my dentist can't recommend to remove my mercury fillings if I had health issues that mirrored those of mercury toxicity?
Bingo.
But having mercury in my body increases my risks for adverse health events.
Correct.
So it would make sense that removing mercury fillings, which are the highest source of exposure, would reduce my risk.
I agree. You just won't find a dentist who will say it first, and most won't agree with you.
Why not?
The ADA Code of Ethics states that a dentist who represents that dental treatment recommended or performed by the dentist has the capacity to cure or alleviate diseases, infections, or other conditions, when such representations are not based upon accepted scientific knowledge or research, is acting unethically.
I don't think I want to be a dental patient here any longer.
I don't blame you.
Any suggestions for a new dentist?
Yes. Look up the International Academy of Oral Medicine and Toxicology. None of their members place mercury fillings.
That is great. So they are mercury-free?
No, not at all. They are mercury-safe.
Explain, please.
Every time a dentist removes a mercury filling, they are exposing dental staff and patients to levels of mercury vapor and mercury-contaminated particulate matter over 2,000% higher than occupational safety levels. They do this without providing any protection whatsoever.
Geesh almighty. That is bloody criminal.
Quite true, as most dentists are not following many OSHA regulations.
OSHA?
The Occupational Safety and Health Administration.
Ooh, I see. So what is the name of that mercury-safe dental organization again?
The International Academy of Oral Medicine and Toxicology. They wrote the book on how to safely remove silver mercury dental fillings while protecting dental staff and patients.
Thanks so much for the information.
No problem. Good luck.